Hello, welcome to our online training, Managing Challenging Patient Interactions. My name is Johanna Rosenthal, and I'm a project manager for Cardia.
And I'm Renee Marshall, also a project manager with Cardia. On behalf of the California Primary Care Association and Cardia, we are pleased that you have selected this module to support your professional development. Cardia is a nonprofit, mission-driven organization with a principled team of committed and passionate staff. We have dedicated our careers to helping health and human service providers offer their best to their patients. You see here on the slide the official mission of the organization. You may be aware that CPCA is offering this training as part of their Patient-Centered Health Home Recognition Program. This initiative is for its member clinics to support their efforts to achieve Level 3 standards of National Committee for Quality Assurance Recognition. CPCA has made a commitment to support every member community health center to become a patient-centered health home. For more information, go to CPCA's website, listed here.
So let's begin our discussion on how to best work with or provide services to patients who at times may be difficult for us. Providing excellent customer service and professional care day in and day out is challenging even with the most cooperative patients. So when you have a challenging patient interaction, maintaining a flexible and professional manner is even more demanding and stressful. It doesn't matter whether you're dealing with patients on the telephone, in the reception area, while taking their vital signs, in the laboratory drawing blood, or while providing direct health education and patient care. Simply put, challenging patients can be draining. You have probably had your share of encounters with such patients and found that it definitely did not make your day. You may have felt frustration, sadness, anger, and a variety of other negative emotions when you have been challenged by patients throughout your work week. In this module, you will learn ways to respond professionally in any situation. We will discuss practical, proven approaches that will help you improve your skills to resolve conflicts, build goodwill, and reduce stress during every interaction.
There are 3 objectives that describe what we hope you will learn by the end of this course. The first objective is to explain how good customer service can help to prevent challenging situations. Second is to describe strategies that appease upset patients. And third, to identify communication styles to avoid when interacting with a difficult patient. The knowledge and research in the area of challenging patient encounters, as well as wisdom gained, has evolved over the years. It is this information that we plan to share with you today. We're going to do this by defining the challenging patient, by creating a list of reasons why patients behave in ways that have a negative impact on you and your staff, by identifying common patient complaints, by identifying ways in which you can cause or contribute to negative behavior of patients, by discussing the effects challenging patients have on your emotional well-being and your work, by identifying what patients want from their healthcare system, by defining and discussing the role of quality customer service, and by offering a variety of strategies and approaches in communication that will help you deal with challenging patients. We'll also use scenarios to reinforce several of the strategies.
Because you are already working diligently to be part of a compassionate, efficient, and effective healthcare delivery system, you naturally want to have positive and effective patient interactions as well. And when patient interactions do not go as planned, you want to deal with them as thoughtfully and effectively as possible. You want to be able to change the context of the situation so that a challenging patient becomes a person who allows you to create the highest quality service. Your goal is to create a win-win situation. Let's start with some definitions. What is a challenging patient? Dr. Monica Lalanda offers this insight. Challenging patients are not those with difficult medical problems. We have the knowledge, the training, or the resources to deal with those issues. Such patients are those that engender in us a negative emotional response. patients who trigger strong feelings of frustration, hopelessness, exasperation, sadness, or even anger. Webster's online dictionary's definition of challenging helps us further define this type of patient or encounter. When used as a verb, challenging means to defy, provoke, or irritate, to confront or face, withstand, or oppose. When used as an adjective, definitions include disturbingly provocative, being defiant, demanding, difficult, or contrary.
The bottom line is, a challenging patient is one that usually will cause you to feel something negative. It is the kind of patient for whom you will need to use one or more specific approaches to change the tone of the encounter. You may have to focus on creating a shift in the patient in such a way that the behavior doesn't escalate to a more unpleasant one. But there can be a silver lining. Sometimes you can actually facilitate a shift so that the patient becomes someone you enjoy. You learn something valuable about the patient, perhaps about the behavior in general, even about yourself. The encounter actually contributes to the quality of your day. Sometimes considering the reasons for the patient's behavior can help you to feel empathetic, which can then make it a little easier for you to manage difficult patients. One major reason for such behavior is about as basic as it gets. Something in the patient's life is having a negative impact on the way he or she feels, and it has nothing to do with you. The patient comes into the clinic with this something weighing on his or her shoulders, or is feeling vulnerable due to a personal situation. Just about anything and everything can worsen how the patient is feeling. Unfortunately for you, this can translate into negative body language, facial expressions, tone of voice, and the choices the patient makes in the ways in which he or she offers you information and accepts information from you. The list of possible reasons for challenging behavior is endless. A mom comes in for her appointment, but she left a child ill at home with a babysitter. Someone comes to the appointment having had to beg for permission to leave work early that day. Money is tight, there isn't enough food, or a person had an argument with a significant other. The person feels pain, nausea, headaches, or any number of symptoms. The person is frightened and worried about having a health problem. The prescribed treatment program isn't working, or the person feels worse with the medication she is taking. There also could be the effects of substance abuse or an unrecognized psychiatric disorder.
There's another important factor that can affect a patient's behavior, and it has to do with loss of control. You will probably agree that many patients you see at your healthcare facility are there not because it's what they want, but because they must be there. Sometimes they've been brought in unwillingly by a family member or friend. People usually feel like they have some control in their lives, but when they come to you, they lose this control. You now have the control and give them instructions they must follow, beginning at the reception desk.
I need your ID and insurance information. We need you to wait here, there. You need to take your clothes off.
Then they are physically touched, which for some can feel uncomfortable or invasive. Add this loss of control to perhaps feeling frightened by not being well, and their stress level is at its highest. And though some of them may look like trouble just because of their personality, most of the time you're dealing with the effects of loss of control, stress and worry, all of which may be a part of their health concerns. Other reasons for challenging behavior could include the patient's behavior that you consider difficult is one that was formed from early life experiences. Waiting for a prolonged period of time in the reception area or in the examination room, particularly if the person is needing to get back to work or to children, is a common reason for a patient's negative behavior. The patient doesn't feel listened to by the healthcare system. The patient may have had a previous experience of poor care or painful or disappointing care, or there is a language or literacy or comprehension barrier.
A 2012 article in Newsweek highlighted a couple of cases in which the doctors didn't listen to their patient's ongoing symptoms, and in one case resulted in a patient dying of kidney cancer. The article continues, "These days, stories like these are cropping up all over, and while most don't have such tragic endings, they are signs that something in the world of medicine is seriously amiss. Unhappy patients gripe about their doctor's brusque manner and give them bad marks on surveys and consumer websites like Healthgrades and Angie's List. They tell tales of being rushed out of the office by harried doctors who miss crucial diagnoses, never look up from their computers during an exam, make errors in prescriptions, and just plain don't listen to their patients. Studies show a steep decline over the last 3 decades in patients' sense of satisfaction and the feeling their doctors are providing high-quality care. And things don't seem much better from the other side of the stethoscope. In a recent survey by Consumer Reports, 70% of doctors reported that since they began practicing medicine, the bond with their patients has eroded. The complaints noted in Newsweek, combined with those of ones previously mentioned, excessive waiting time, patients feeling rushed and not having enough time with a provider, can affect patient behavior and the quality of patient-staff interaction.
But before we begin discussing how to best respond to and manage challenging patient interactions, it's important that we first talk more broadly about customer service, since good customer service is the foundation for being well equipped to handle difficult situations and difficult patients. Also, good customer service is likely to prevent situations where patients behave in challenging or difficult ways. Of course, we do know that there will be patients who challenge you no matter how good your customer service is, so we will obviously discuss that later. Let's take a look at why good customer service is important. Providing good customer service assists both patients and their providers. Satisfying your patients will make your work more rewarding and foster the success of your organization.
If the services and staff members are respectful and responsive to a patient's health needs, beliefs, and values, patients will feel more comfortable and satisfied. If patients are more comfortable and satisfied with the services and providers, they are likely to return for future services. These same patients are also likely to recommend services to others in the community, making your agency more accessible to new patients. Researchers have found that 88.2% of consumers choose healthcare based on word of mouth. A satisfied client tells 3 to 5 people, and an unhappy person tells 11 to 20 people. If you are providing good customer service, you can count on your patients telling their family, friends, and coworkers, thereby increasing the number of patients who choose your clinic because they've heard how great it is. Research has shown that 68% of those who don't return to a health facility indicate they were dissatisfied with how they were treated. So clearly, a practice that has trained its staff in customer service will have a better chance of keeping its patients.
Most importantly, good customer service will also improve your communication with your patients, which will lead to better adherence to your medical advice and better health outcomes. Patients tend to be more compliant with instructions about their health care when clinicians and other staff show genuine concern for their well-being. Customer service is not an extra. It is an essential requirement for providing high-quality health care.
Let's take a look at who our customers are. In our everyday world, we really have 2 sets of customers. The first group is internal customers. These are the individuals that are part of the organization. So that would mean managers, physicians, nurse practitioners, physician assistants, health educators, billers, front office, and other colleagues. This list should really include anyone who works at your site or within the organization. We're mentioning internal customers because good customer service with staff improves staff morale and provides a model of what good customer service looks like with our external customers. Unhappy, dissatisfied, or disgruntled staff will be hard-pressed to provide good customer service to their external customers.
Secondly, we have external customers, who are the individuals that are not employees or people that are part of the organization. External customers are your patients. They're the pharmacies, the laboratories, and other healthcare organizations with which you do business. They expect and deserve excellent customer service and will seek services elsewhere if they are dissatisfied. Many of the suggestions for good external customer service also apply to internal customers like staff and colleagues. Though we will mostly focus on your largest external customer group, your patients, keep in mind what suggestions apply to internal customers as well. Now let's think about customer service from your own personal experience. Think of a time when you were a customer and experienced excellent customer service, for example in a health clinic, or it could have been at an auto mechanic shop or a bank. What about this service made you remember it? What made it excellent? Pause the video for a few minutes as you answer these questions.
Your patient's expectations are no different than your own. Patients judge the quality of customer service against these expectations. The following slides provide some key insights into patients' expectations. Communication problems are the most frequently cited sources of dissatisfaction for women. Waiting time has a strong impact on satisfaction. Longer waits resulted in dissatisfaction. Age seems to have an effect on patient satisfaction, with younger women being more concerned with quick services and older women focusing on the quality of their care. Privacy and confidentiality are particularly important to patients receiving reproductive health care. Since we know our biggest customer group, our patients, has expectations that affect their satisfaction with our services, what should we do to meet those expectations? This section discusses specific ideas for meeting patient expectations and includes additional information on good communication approaches. Suggestions for responding to patients who are dissatisfied are highlighted, as well as the importance of an organizational commitment to excellent customer service. As a healthcare provider, you want to know your patients' challenges, needs, and expectations, and then don't just meet them, exceed them. Make the services at your clinic responsive to what's important to your patients.
Take a moment to think about how your patients evaluate their experience in your practice. What elements do they think about? Patients evaluate medical practice in 6 dimensions: medical expertise, environment, systems, amenities, affordability, and of course, people skills. It is important to think about overall satisfaction, which includes both clinical care and personal customer service. Here are some specific suggestions. It may seem intuitive, but when people need health care, they expect their providers to have a high level of medical expertise. Providers should not only have excellent knowledge, but should have excellent exam skills as well. And all staff should be up to date on the latest treatments and technology. Patients expect the environment to be appealing as well. Office and exam spaces should be clean, uncluttered, and in good repair. The space should be accessible to patients who may have difficulty maneuvering, and the surroundings should be safe. Weekend or evening hours can make accessing health care much easier for patients who do not have flexible work schedules. In general, it should be patient-friendly, which means putting the patient's needs above all else. And good people skills are essential. Having a friendly, knowledgeable, trained staff is one of the single best ways to meet both your patients' health care needs and to keep those patients happy. And all staff should have excellent communication skills.
In our increasingly diverse communities, more and more, staff must be responsive to limited English proficient patients. While this can be difficult, the use of medical interpreters or interpretation services is becoming increasingly more available and easy to use. Offering patients translated materials, particularly educational brochures, consent forms, and medication information, is also important in order to be sure that patients understand their options and are truly giving informed consent to treatment. Patients want their questions and concerns addressed in a timely way. For example, can patients email your office or their provider directly? Is an advice nurse available? For questions that don't require the time needed for an office visit, these options can make life a lot easier for your patients. Having in place efficient systems is another element of good customer service. Phones should always be answered quickly and consistently. and being able to provide as short an interval as possible between calling for an appointment and getting in for care is ideal. A patient's visit at your clinic should be easy to navigate. There should be an intuitive patient flow in place, including enrollment and other various stops during the visit. Wait times while in the facility should be short. Few things are as frustrating to a patient as long wait times, no matter where they occur. And report test results to patients as quickly as possible to reduce their anxiety.
Providing useful amenities is a good way to keep your patients happy and reduce their stress. If possible, provide access to free parking or close access to public transportation. Provide a family-friendly clinic space, such as toys and children's reading in the waiting room, along with coffee for the adults. Attractive educational materials and displays make the space feel modern and invite patients to actually read them. And of course, free samples of medications or supplies are always appreciated by patients. And lastly, affordability is a major component of good customer service. Low out-of-pocket costs means patients can feel comfortable seeing you when they need to, and not feel like they have to wait until a condition has gotten unbearable. This can reduce your patient's stress levels, which ultimately can lead to better health outcomes. Practicing good customer service will go a long way toward minimizing the number of challenging patient interactions you have. Just as it is with health, prevention techniques can save you time and stress in the end. Good customer service will increase the likelihood that your medical setting will be a welcoming and inviting place to be for all of your patients.
Let's shift gears a bit and talk specifically about communication. We mentioned communication earlier, but because it's so important, we're going to focus on this a little bit more. Communication is key. 2/3 of all customers who are dissatisfied are not unhappy because of the quality of service or cost, but because of poor communication with providers and other staff. Effective communication skills include a warm greeting, smiling, handshakes, good eye contact, asking open-ended questions, and listening actively to a patient's responses and concerns. Additionally, communicating in a culturally and linguistically sensitive way is essential. We can't forget that you spend a lot of time on the phone with your patients, where you don't have the advantage of using body language or your facial expression to communicate in a customer-friendly way. Think about your own personal phone style and decide if there's anything you can do differently that might increase patient satisfaction. Do you answer the phone promptly within 3 rings? Give a clear, upbeat greeting? Identify yourself? Identify your department if appropriate? Ask for the caller's permission before putting him or her on hold? Ask if the caller would prefer to call back rather than holding? Keep your tone friendly and informative even if you're feeling otherwise? Express interest and caring? Using these phone tips can help your patients feel taken care of even before they reach your clinic. When taking messages for a staff person who is currently unavailable, first ask if it's something you can handle. If so, it will save time for everyone to just go ahead and do it. When you get the caller's name and number, repeat it back so that mistakes aren't made later. Then, take as detailed a message as you can, which will, again, save time and effort later.
Here are some other ways to provide good customer service, some of which may seem obvious to you, but you might be surprised by what gets overlooked when staff are stressed by any number of factors that can surface throughout the day. Greet patients throughout the visit. Acknowledge their arrival with a smile and greet the patient warmly. Make eye contact. Use a positive, sincere tone of voice. Be available and responsive. Let the patient know that you're there to help. Notice when someone needs help and provide it. And if in doubt, ask what the patient needs or wants. Provide whatever help you can. Put yourself in the other person's shoes. How would I want to be treated in this situation? Do whatever you can to solve a problem and take responsibility. If you don't have an answer, find it. Listen and demonstrate a caring attitude. So what would that look like? Use body language that demonstrates listening. Ask open-ended questions such as, "Tell me about," or What can we help you with today? Repeat back what you have heard for confirmation. Show respect and appreciation. One way this may look would be to acknowledge the inconvenience of long waits. You could say something like, "I can really understand how frustrated you must be after waiting this long." Always explain what is happening and why. Let patients know if there's a delay and offer options to reschedule a visit whenever possible. And always thank people for their patience, their cooperation, and their understanding. Even if they aren't really being patient, by thanking them for doing so, you subtly let them know what behavior you hope to see from them. And in most cases, that is the behavior they will show. Again, these tips may seem obvious, but we've all certainly encountered situations where customer service was not as good as it should have been, and it probably made a lasting impression.
Now let's look at ways that you might contribute to negative patient interactions. Sometimes it's because of a patient's behavior or who they are, but other times it may be because of what you have experienced or what your day has been like. Given all that you and your clinic does to help patients, there will be challenges in your everyday work that can affect your behavior, and sometimes circumstances that make it more difficult to provide good customer service. For example, you may be expected to see too many patients on any given day. Many of these patients will be quite ill, some in extreme distress. In addition, some may be behaving in ways that create a negative reaction in you. A patient's tone of voice, how loud he is speaking, his body language, the way he's using his hands and moving his body may make you feel uncomfortable, angry, or evoke some other type of negative reaction. You, without even realizing it, may find yourself behaving in the same way. This is a normal, though not positive, reaction. You may not like a patient, or you may have a patient that is wonderful, but you're feeling rushed because you're behind in your work. Maybe you're having a bad day because of a personal issue. You may not be feeling well physically and/or emotionally. You may notice that these reasons are very similar to the reasons that can contribute to patients being challenging that we discussed earlier. Because of any of these and other factors, you may sometimes communicate with a patient in a way that results in a strained interaction with that patient. Consider taking some time to evaluate your communication style in a couple of ways. Ask one or more of your colleagues or fellow staff to let you know if they observe you communicating in ways that they perceive as negative. This should be done in a way that is supportive and not critical. This exercise could be integrated into your clinic's quality assurance activities as a structured team approach to improving patient care. Ask friends and family for feedback about the ways you communicate verbally and non-verbally. Remember, try not to feel criticized by this feedback, but see it as an opportunity to improve the way you communicate. Take time to observe yourself with the next few patients with whom you spend time. Listen to the tone and volume of your voice. Pay attention to your body language, how you are standing or sitting. What are you doing with your hands? What kind of eye contact and facial expressions do you have? Are you communicating patience, careful listening, and non-judgment? Pay particular attention to how your body language makes you feel and if it affects your ability to listen to the patient. Are you feeling tension in your back or neck? Do you feel your facial muscles tense up? If you recognize you are communicating in any way that could cause a negative reaction within you, it's probably causing a negative reaction with a patient. Consider the reasons for the reaction. When you identify the reason for your behavior or your reaction, you are then able to consider what you need to do to help yourself improve your ways of communicating. It's only human to have a bad day, regardless of the reason, and it's normal not to like things about a patient, and you won't always communicate exactly as you want or should with each patient. However, by identifying how your life and work factors affect your communication with patients, and by thinking about characteristics of patients you don't like, you're better able to work on these areas about yourself and prevent them from getting in the way of good service.
Now let's take a few minutes to think about types of patients or situations that are most difficult for you. Doing so can help you prepare and think through what you would do when you truly are perhaps rubbed the wrong way. I'm going to read the lead-in sentence, and then we'd like you to pause the video and really try to honestly respond. So here we go.
If I'm involved in a conflict, I tend to...
Now go ahead and pause the video. Okay, hopefully you were able to think about how you really do respond, whether it's
become defensive or withdrawn,
or
want to smooth things over right away.
Whatever your response was, the purpose is to become more aware of your personal style or whatever your tendencies are. Let's do the next one.
A strength of mine in dealing with challenging situations and patients is...
Again, please pause the video and take a moment to think about your response. How was that one? Perhaps some of your strengths were along the lines of,
I always ask how I can help.
Or,
I pause for a few seconds before I respond to someone if a button of mine has been pushed.
And let's do one more.
My greatest fear about encountering a really difficult patient is...
Once again, please pause the video. Possible responses you might have had could be,
I'll feel speechless and won't know what to say. They'll slow down my work and the schedule is tight enough.
or,
I won't be able to keep my cool if it's the end of the day.
Knowing some of these things about yourself can help you to think about a game plan for when these kinds of patients or circumstances arise. It's okay to take a moment to think about your response or even step away for a moment. What other staff person can step in for you if it's been a long day and you're at the end of your rope? Maybe your time is better spent moving on to the next patient and another staff person can address your patient's concern.
So now you've taken some time to think about your own reactions and behaviors. And we've talked about how providing excellent customer service can help you minimize negative or difficult encounters. But we all know that even if you and your staff provide excellent customer service, you may still encounter patients that are challenging. Let's first talk about how nonverbal communication can help or hurt a patient encounter. You communicate with patients both verbally and nonverbally. Verbal communication is obviously the words you speak, but also the tone, pitch, and volume you use when you are speaking. Remember that much of what one communicates is nonverbal and can be very powerful. Nonverbal communication, or your body language, is very complex and includes your facial expressions, your eye movements, how and when you stand and sit, and the posture you use, the way you cross your arms, and much more. Remember that earlier in the course we asked you to observe yourself and try to notice how you communicate nonverbally and what that communicates to a patient. Here are some do's and don'ts that can help you communicate in a positive way and help improve your outcome when you encounter a challenging patient. Some of these points are from Marie Britton's article entitled Improving Patient Care: Keys to Improving Your Listening Skills.
First, the do's. Do remain calm. Nothing can escalate a situation more than your own reaction. When you remain calm, it sets the expectation for whomever you are interacting with that calm is how you operate. It also can give you a chance to calmly reflect on what would be the best course of action with your difficult patient.
Saying you're sorry can go a long way. It doesn't necessarily mean that you're taking responsibility or that you did anything wrong, but it's showing that you're sorry that they're upset or inconvenienced or whatever the situation might be. People need to feel heard and understood.
Check for understanding by repeating back what you've heard. You might say something like,
Let me review what I've heard you say to make sure that I understand your concerns.
This lets the person know you're listening and trying your best to help them.
Suggest possible solutions to the problem and take immediate action. And, if possible, take care of it yourself. If not, bring it to the attention of someone who can.
Do concentrate on the person speaking and make eye contact. Be sure that you are close enough to and looking at the patient to observe his or her facial expressions. Facial expressions, gestures, and posture all convey the patient's thoughts, so pay attention to them. If you realize by the patient's facial expression that you've said something incorrect or worrisome, Correct yourself or ask the patient about his or her reaction.
Eliminate distractions. Time constraints and pressures are often unavoidable, but they should not compromise your care. When a patient is speaking, do not read a chart or accept a telephone call. If your staff is dedicated, enlist their help in limiting such distractions during face-to-face encounters. For example, if the chart and exam room are well organized before you enter, you won't have to search for information or supplies when you should be listening to the patient.
Do use active listening techniques. Allow your body language to show that you're listening through head nods, smiles, and small verbal comments like yes and uh-huh. Occasionally paraphrase or rephrase what your patient has said to be sure that you have correctly interpreted the information they have given you, and respond to their concerns respectfully.
Avoid trying to think of an answer while you are listening. When a patient is speaking, focus on what he or she is saying rather than on what you're going to say next. Even if you disagree with the patient, try to keep an open mind and allow the patient to finish his or her thoughts before you jump in.
Do allow the person to vent without interruption. It has been estimated that physicians interrupt patients within 23 seconds as they try to explain their problems. Be conscious of this. When someone is upset, they want you to know why. When someone is able to vent completely and feels that they have been heard, then they are then more likely to be able to move on by allowing you to either apologize or to make it right.
Pay attention to vocal inflections. The tone of a person's voice can often tell you more than his or her words. It may suggest that the person struggles with anger or depression, or it may point to a physical problem. In some cases, you may need to get past the person's tone of voice in order to listen effectively. For example, based on the tone of voice, you may be tempted to dismiss a patient as a complainer. Before you do that, listen and make sure there are no legitimate issues you need to address.
And now for the don'ts. Don't ignore a patient who is trying to communicate with you. There are few things more frustrating than being ignored. Even if you feel a patient's concerns are unwarranted, hear them out. There may still be some useful information in what they are telling you. Listening will help you engage fully with your patients, make better decisions, and ultimately provide better patient care.
Don't make assumptions without checking. Only by asking will you find the full story, which will aid you in being able to help your patient. And by assuming the wrong thing, you risk offending or alienating your patient.
Don't judge or moralize your patients. It's impossible to know all of the details that make anyone behave the way they do, so be supportive of what your patients do right, rather than judging them for the ways in which they aren't as successful.
Don't hold silent resentment toward your patients. No matter what happened at the last visit, treat each new visit with a patient as a clean slate. You may be surprised at how positive a patient visit with a formerly difficult patient can be when you let go of what happened last time.
Don't use sarcasm. Sarcasm is easily misunderstood and often leads to hurt feelings. Instead, use direct communication so that whatever you are trying to say to your patient is clear.
Don't use excessive or inappropriate questioning. It can be frustrating for a patient who is conveying difficult or personal information to be repeatedly questioned about it. Instead, wait for the person to finish speaking and only ask the few pertinent questions you need in order to help them. Whether it's a medical issue or customer service issue, keep your questions to a minimum and instead keep the focus on what the patient is trying to tell you.
And finally, don't take it personally. Our patients have bad days just like we do. They may say something that feels judgmental toward you or that is rude, but know that it might be more about the bad day that they're having than it is about you. So feel free to just let it go.
Now it's your turn to have a chance to practice your responses to difficult patient interactions. Using what you have learned so far about communicating with patients, take a moment to listen to each scenario and select from the possible responses. Just as you did earlier in the module, pause the module while you make your selection from the possible answers. The first scenario is about a frustrated patient, Patient A. Patient A has been chronically ill for over a year. Many diagnostic tests have been performed without any clear conclusions. He becomes visibly agitated at the lack of a clear direction for his care. Why can't you figure this out? I keep coming in here for more tests and never learn anything new. I feel like I'm wasting my time here. What would be the best response? A.
Everything will be fine. We just need a couple more tests.
B.
Please calm down. We're doing the best we can.
Or C.
I can see that this is frustrating for you.
Pause the module while you make your selection. The best response is C.
I can see this is frustrating for you.
This response reflects back to the patient what you're seeing, which is their frustration. This is clearly a patient who has had numerous tests already without any answers to a condition that may be painful or uncomfortable on a daily basis. By letting the patient know you heard him and that you realize how frustrating this is for him, it allows him to now focus on the next step, which will be an explanation of your plan for his care.
What if your patient is angry like patient B? The doctor had an unexpected emergency to tend to, and patient B is a long-time patient who has been waiting in the waiting room for over an hour. She tells the receptionist, "This is outrageous. Whenever I'm more than 10 minutes late, I lose my appointment, but the doctor is able to just keep me waiting as long as she wants to? Your policies are unfair and disrespectful of my time." What would be the best response? A.
I'm only following our procedures. The doctor will see you shortly.
B.
I apologize for the wait. The doctor is dealing with an emergency situation and should be available shortly. Would you like to reschedule or continue waiting?
Or C.
Our policies are very fair and protect the doctor from patients who don't show up to their appointments. Today is just extremely busy.
Pause the module while you make your selection. The best response is B.
I apologize for the wait. The doctor is dealing with an emergency situation and should be available shortly. Would you like to reschedule or continue waiting?
This response is best for a couple of reasons. One, because it starts with an apology. This lets the patient know that you recognize and are sorry for their wait. Two, it ends by putting the ball back in the court of the patient. Would they like to reschedule or continue waiting? You don't get into an argument about the fairness of your policies, but rather you give control back to the patient by allowing them to decide which of their options would be the best one for them.
This kind of scenario may not be typical, but it's nonetheless challenging. Patient C is here for the first time and is complaining of back pain. You ask several questions to get more specific information, and she just shrugs her shoulders and mumbles, "I don't know." What would be the best response? A.
In order to best help you, I need a little more information. What would help you to feel more comfortable sharing with me?
B.
The best I can do is to prescribe you a pain blocker.
Or C.
Well, I can't help you if you won't talk.
Please pause the module while you make your selection. The best response is A.
In order to best help you, I need a little more information. What would help you to feel more comfortable sharing with me?
Instead of just giving up or showing your frustration as the other responses do, this response lets the patient know that you really do want to help them and that you want to help them feel comfortable with you. It also changes the focus of your questions to their comfort with you, the practitioner, rather than on their pain. Perhaps there's something embarrassing or hard about their condition that makes it difficult to talk about. This approach helps the patient know they can feel safe with you.
What if you realize your patient is under the influence of something such as alcohol? You begin talking with patient D about his health concerns when you realize you smell alcohol in his breath and that his speech is slightly slurred. What would be the best response? A.
How can I help you today?
B.
We do not serve intoxicated patients. Please leave at once.
Or C.
Because it seems you have been drinking, I think this is not the best time for this appointment. Let's have you reschedule and then figure out the best way for you to get home safely.
Pause the module while you make your selection. The best response is C.
Because it seems you have been drinking, I think this is not the best time for this appointment. Let's have you reschedule and then figure out the best way for you to get home safely.
With this response, you're not passing any judgment on the patient. You're simply observing that they have been drinking and then offering to reschedule. You also show that you care for the patient by helping him to figure out how to get home without driving while intoxicated. You would not want to go ahead and treat this patient even if they are not disruptive, because any time someone is intoxicated, their judgment is impaired. Therefore, they would not be able to truly consent to any treatment plans you may discuss.
Here's another kind of patient your receptionist or front desk person might encounter. Patient E insists she needs to know her test results right now. After you, the receptionist, explain that only the doctor delivers test results and that he is not in at the moment, the patient keeps insisting that she must have these results immediately. What would be the best response? A.
I can see that you need these results quickly. Let me see what would be the soonest the doctor could deliver them to you.
B.
I'm only following the rules. You'll have to come back later.
Or C.
Sorry, there's nothing I can do for you.
Pause the module while you make your selection. The best response is A.
I can see that you need these results quickly. Let me see when would be the soonest the doctor could deliver them to you.
This response is another one that uses a couple of good strategies. First, the response reflects back the patient's need to have her test results right away, so that she knows you understand her urgency. Second, instead of arguing about why the results can't be given right now, the patient is told when she can have them. This keeps the conversation positive, what can be done, rather than the negative, what can't.
And what about the manipulative patient? Patient F frequently runs out of her medications before requesting refills. She shows up at your clinic begging for free samples on a regular basis rather than requesting refills before she runs out. What would be the best response? A.
Okay, we should have lots of samples in the cabinet.
B.
Absolutely not. Take some responsibility and request your refills on time.
Or C.
Let's talk about why it seems to be difficult for you to request your refills on time and brainstorm better ways to help you make sure you have your medications.
Pause the module while you make your selection. The best response is C.
Let's talk about why it seems to be difficult for you to request your refills on time and brainstorm better ways to help you make sure you have your medications.
The key here is to help the patient take care of herself by suggesting that you problem solve together. Continuing to provide her with free samples is allowing her to take advantage of the free samples you provide to patients periodically. You also want to encourage your patient to follow the policies and procedures of your clinic by helping her get her medications from the pharmacy.
We've discussed many factors that can negatively influence patients' behavior, your behavior, and the quality of your communication. We've also acknowledged the challenges you are faced with every day as you are taking care of patients. All of these factors and challenges are considered stressors, or things that can cause a stress reaction in your body. Other stressors include normal, natural, everyday events in your work. It is important to remember, even if you never had a challenging patient and everything every day with everyone went perfectly at work, you would ultimately feel the emotional and physical effects of the stress of your work. It is inevitable because consistently thinking about what you are doing, ensuring you're doing it correctly, and interfacing with many people and a plethora of information causes those specific and powerful physiological reactions we call stress. Add in normal, everyday stressors such as traffic, waiting in lines, interactions with others outside of work, and your stress reactions are increased. Then add your personal life challenges, and you have an even greater chance of experiencing more and more stress. It's stressful just thinking about it. Is stress bad? Not always, but when it's allowed to continue and when it's not dealt with effectively, it can take an enormous toll on your work and your emotional and physical health.
So what are some effective ways to manage stress? Identify resources that help you look at the effects of your work life and other parts of your life that are causing you to feel stress. Support stress management activities at work. A workplace should ideally give staff opportunities to have some quiet time throughout the day, even if it is several couple of minute breaks to just breathe deeply. Try some mini-relaxation techniques such as this. When you've got 1 minute, place your hand just beneath your navel so you can feel the gentle rise and fall of your belly as you breathe. Breathe in slowly. Pause for a count of 3. Then breathe out. Pause for a count of 3 again. Continue to breathe deeply for 1 minute, pausing for a count of 3 after each inhalation and exhalation. It may feel funny to do this in the middle of your workday, but even just this conscious breathing can help relieve stress. One can say a lot more when it comes to the topic of stress management. We felt that it was important to at least acknowledge the importance of learning how to manage stress in this module, since dealing with challenging patients can be so difficult. However, because we have just scratched the surface, we'd like to suggest that you listen to the CPCA module that specifically focus on stress management.
We have covered quite a bit of information today. While managing challenging patient interactions can be frustrating, we hope we have given you some strategies that will help you maneuver these interactions more easily, leaving your patient satisfied and with the intention of returning to your clinic. Improving customer service and communication are really the keys to smooth patient interactions, by showing your patients that you care and that their satisfaction is your top priority. We have also shown you that self-care, in the form of stress management, will help not only you, but your patient interactions as well. Included with this module is a checklist that summarizes some of the points we have made so that you can revisit them and assess where your site stands in terms of customer service and how you would rate your own communication skills and the ability to deal with challenging patients.
We hope you have found some useful tips and ideas today that will make your practice or clinic a more pleasant one for you, your staff, and for your patients. Thank you so much for joining us today. Goodbye.
For other training, check these websites.